Hypertension is elevated blood pressure. When somebody tells you, hey, you have hypertension, you have elevated blood pressure. So what should you ask your doctor if they tell you you have hypertension? So first of all, you want to make sure you actually have hypertension. Normally we say it needs to be checked on multiple occasions, 2 or 3 times, and it's always elevated. And you've been sitting and rested and not distracted, not talking, not huffing and puffing. You didn't exert yourself. You're just sitting there resting comfortably for 3 to 5 minutes, and they checked your blood pressure and it was high. The guidelines say we want it under 120, or we want it at 115 over 75. Anything 20 to 10 above that increases your risk of stroke by 2 times. So 20 over 10 above 115 would be 135 over 85. That increases your stroke by 2 times normal. If you get higher than that, if you add another 20 over 10, 155 over 95, you've now 4 times higher chance of stroke. So this is how you end up with a heart attack or stroke. With very high elevated blood pressure for a very long time, it destroys the inside of your arteries. We definitely don't want that. Now, most blood pressure problems are called primary hypertension or essential hypertension. You just have hypertension because you have hypertension. There are other things that cause hypertension, like kidney disease, sleep apnea, and other stuff. We have a whole other video on that. Look up the video on secondary hypertension. So hypertension in and of itself is usually easy to treat. One of the easiest ways to treat it is with medications called ACE inhibitors. This is a class of medications that actually comes from viper venom. Believe it or not, it actually comes from viper venom, but it lowers your blood pressure, dilates out your arteries, and it works really, really well. People on ACE inhibitors live much, much longer, regardless of anything else they looked at. Same thing with blood pressure. People with lower blood pressure live much, much longer, regardless of anything else. So ACE inhibitors could be your go-to, especially if the person has kidney disease, not like severe kidney disease, or they have diabetes. It's very cardioprotective. If they have heart failure as well, this definitely helps. Another class of medication you could use is something called thiazide diuretics. These help you dump salt. Some people are more salt sensitive than others, but it definitely can cause you to drop your blood pressure. And they're not really diuretics, even though they're called thiazide diuretics. They're a slight diuretic. The first 2 or 3 days you're on them, you pee a little more, but they eventually function as a arterial dilator. Calcium channel blockers like amlodipine, then the hydropyridones, amlodipine, nifedipine, nicardipine, that class of medications is also an arterial dilator. Beta blockers, if they have alpha blockade work, like labetalol, and carvedilol, propranolol, bisoprolol, nebivolol. There's a few of them that do, but metoprolol and atenolol generally not. They're very beta-1 selective and only drop your heart rate. There's other classes of medication. Something like spironolactone can be used if you have primary hyperaldosteronism. If that's the cause of your hypertension, then this is the correct medication to use, or eplerenone. Both are in the same class. Spironolactone can increase your testosterone, and some people men don't like that because they get gynecomastia, which is enlarged male boobs. So you'd use eplerenone instead because it doesn't have that effect, because it doesn't block testosterone. I'm sorry, not increase testosterone, it blocks your testosterone. So your estrogen levels go up. So you don't want to use spironolactone if they're having that side effect. You could switch to eplerenone. Eplerenone in the past has been not generic and more expensive, so we couldn't use it. But I believe it's generic now. There are a multitude of other medications you could use, but that's kind of the main go-to medications for hypertension. Now, if you have a secondary cause of hypertension, you want to get that treated, whether it's sleep apnea or tumors that secrete certain things. You could look at the other video called secondary hypertension to find out what those things are. But if you like this video and you want to watch some more, there's a whole list here for you.